Sandiso. Can everyone see my screen? Can you see it, Sandiso?
Yes, we can.
Okay, great. So to contextualize our business, because I think not everyone might be familiar with what we do or might be familiar with one arm of the business. We are a healthcare group with operations in South Africa and internationally in Western Europe and expanding into the US and other markets. And essentially our call it main business, 70% of our revenue is in hospitals or kind of what we call acute facilities. So your typical kind of patient comes in when they have a once-off episodic need for healthcare. Now, and we have an expanding business of what we call complementary or chronic disease management. So you think of your kidney disease, renal dialysis, oncology, medical rehabilitation after surgery, as well as mental health. And as I mentioned, of course, the international business is comprised of a diagnostic imaging and molecular imaging business, one of the leading ones in Western Europe, and a radiopharmacy business that supplies essentially the inputs for radiologists to conduct and radiographers to conduct molecular imaging of for example, cancer, PET-CT scans, and to diagnose diseases. So the reason why I kind of contextualized what we do is the list of problem statements that I have are quite broad. So I've tried to go big in terms of putting a big, hairy, audacious problem statement out there, but then giving examples of specific use cases, technologies, and kind of profiles or parts of the business that we would want to serve for each of these 5 statements. So going kind of from the top of the list down, in our hospitals, kind of the key thing for most hospital groups around the world is maintaining margins. There's extreme pressure on healthcare costs in terms of rising cost of healthcare and inflation. And there's, from a revenue and kind of top line perspective, there's not a corresponding growth in terms of pricing and in terms of sort of the insured population, because we operate in the private healthcare space. So for us in the in-hospital space, we're really constrained in terms of the economics, and it's key to either maintain volume, so acquire patients, or retain more of our patients within our system in order to sustain profitability. So kind of the key thing for the hospital acute business in South Africa, the problem statement is how do we improve our patient retention and build more of a kind of, call it, electronic patient database, so we can better understand our patients, their health needs, what matters to them in terms of experience. And in terms of kind of specific examples, but please don't be constrained by these examples. What we'd look for is a portal for patients to pre-admit themselves before going into hospital, so sending in their medical information so we can start to build a record, and kind of managing the admin of day-to-day healthcare more efficiently. So appointment bookings, billing and claims management, and customer support. So moving on to the kind of next line, which really talks to what we call a healthcare continuum, which is one of the trends in healthcare around moving away from simply taking patients into our systems, treating them, and then letting them go their way and not sort of actively managing their health. We would like to find ways to support more proactive management and intervention of patients' health earlier in the journey, so that we can kind of catch warning signs in terms of vitals and improve readmissions rates, mortality rates, and that has benefits, of course, for the patients in terms of better health outcomes, but also for our ability to obviously attract more patients, position ourselves as a superior healthcare provider, and be more attractive to the medical aid and insurance population that would obviously want to contract with providers that offer kind of better health outcomes for lower cost due to more proactive intervention. So a very common use case on this topic is remote monitoring of patients' vital signs and being able to flag interventions quickly to the clinical team. And then on that topic, in terms of clinical team, another trend in healthcare, again, moving away from very episodic patient management to a more holistic view of the patient and more collaboration on a patient's holistic healthcare journey. How do we foster greater collaboration amongst the clinical team, so the general practitioners, the specialists, other healthcare providers, to both give them real-time analytics and insights into how the patient's doing and any kind of actions required, and enable everyone to have sort of a single view of this patient to be able to treat them more effectively and interoperably. Moving on to the international side, as I mentioned, we have a molecular imaging business with a radiopharmacy arm that operates in select regions in Europe. And the challenge statement there is, how do we make our molecular imaging supply chain more reliable and cost effective? There's a very short half-life between the radiopharmacy providing these isotopes into a facility to conduct scans. How do we make sure we're better monitoring these shipments to ensure we're maximizing the half-life and being able to better forecast supply and demand and ensure better reliability across the value chain? And then lastly, I guess this is more of a generic use case because it's not kind of specific to healthcare, but in terms of our group support functions, something we really want to explore is how do we introduce more accuracy, efficiency, and insight generation into our manual kind of processes and systems. So an obvious one is financial reporting. So something like robotic process automation would be of interest of us in the shared services space. So that's our kind of brief. I will take questions at the end. Thank you.